Thank you.
Over to you.
Thank
yes,
you.
Well done.
Thank you. Firstly, I'd like to say thank you for shortlisting us and for us being here. It's a real honour. I think anyone who works with children and young people, it's really important that their voice is heard, because quite often what we find is that as health professionals we listen to parents and carers, but we don't actually listen to the people at the heart of our service. So just to introduce myself, my name's Mel Gilbert and I'm the matron for child health at the Royal Cornwall Hospital in Truro. And this is my colleague.
I'm Tabby Fergus. I'm a practice development nurse for child health.
And so we'd like to talk to you today about the success of Takeover Day. So in November, or September, sorry, 2016, we had our PICA inpatient survey results back. And although we did very well and we were meeting the national average for engagement with families and their carers and the 11 to 16 age group, what was quite evident when we got our results back was actually we didn't really engage with our 8 to 10-year-olds. And that made us think, you know, we've got these results, we really need to empower the 8 to 10-year-old age group. So myself and Tabby then went into a planning phase, and we had some help from Bev, our patient experience manager at the time. And so what we wanted to do was we wanted to work with a local school. So we went out to local schools in Cornwall, and they basically went through an application process, which was very exciting for them. We obviously had to think about consent. We also had to think about the best day to bring them into an acute paediatric setting, because those of you that work in an acute paediatric setting, it's quite a challenge at times. And then what we really wanted to focus on was what did we want that group of children to help us with. So the planning phase did take quite a long time because we just wanted to get it absolutely spot on for us and for the children that were coming in. And what we were doing was we were trying to get a real energy about the day. So we were liaising with our senior teams and the patient experience team, lots of kind of highlight and focus on the day. And the 4 topics that we wanted help with were, we wanted a wonder wall. So I don't know if anybody has wonder walls in their organisation, but they are basically a wall where you as patients and carers can come and write feedback for the hospital, for staff members. And we had those around the hospital, but what we didn't have was one specifically for children and young people. We also wanted help to design a survey specifically for 8 to 10-year-olds, because we had a survey for parents and we have a survey for 11 to 16-year-olds and that age group had actually helped us design that survey. But what we didn't have, and what was clear from our survey results, was we didn't have a specific one for 8 to 10-year-olds. We wanted them to come in and help with our survey design. We also wanted them to be participants in a hand washing audit, because obviously, you know, hand hygiene is really important, and we wanted them to really lead on that. And that was brilliant, because there's definitely a blame culture with children. They were spot on pointing out who hadn't washed their hands properly. And we wanted them to really tour our unit and be involved in everything that we do. And one of our consultant paediatricians then did a simulation training event with them as well. So just a few pictures of Takeover Day. So we had an arts and crafts session in the morning, and the pictures that you see on the top there, that was, we wanted the children and young people to design our wonder wall, and because we live in Cornwall and our inpatient areas and our outpatient areas are mainly named around beaches and coves, we wanted a sea theme. So we had the children design what they think that our wonder wall should look like. We also did tours of the unit. What the children found really exciting was having a lanyard. They found that the best part of the day. And also they had a cordoned VIP section in our canteen, which was amazing. So they also were able to kind of sit down and ask us questions as senior leaders. There's a picture there of the sim. And then the lady in the middle on this last picture here, that's our head of nursing for our care group. So they got to kind of mix with people from, bless you, from all over our unit. So I'll just hand over to Tabby.
Thank you, Thanks. Hello. So I'm just going to talk about some of the highlights from the day and what we got from it. So we really wanted to get as much insight from the children as possible. And what really surprised me in particular on the day was that a lot of what came across from the children was very, very simple things. So when you ask children what's important to them, it's really important to listen because it might not be what adults expect it to be. So we thought maybe they want a skate park, maybe they'll want a cinema or a bowling alley. And do you know what? Overwhelmingly, what they wanted was a comfy bed. They really wanted a bit of comfort. They wanted nice food. They weren't overly bothered about the parents, which was quite surprising. And overwhelmingly, they wanted people to offer companionship. And that really surprised me. They wanted the doctors and the nurses to spend time with them. And that was a massive expectation from them. So you can see when I might say, oh, I'm just going to go and get your antibiotics and I'm gone for half an hour, that might leave an 8 to 10-year-old thinking, where's she gone? What's she doing? Because they're expecting us to spend time with them. And a real key theme from the day was I wanted them to ask as many questions as possible. And as long as their questions were reasonable, I said, you can ask them. As long as they're kind, as long as they're reasonable. And one of the best bits for the children was the tour. We went up to our paediatric admissions unit and there was a young family, a mum and a dad, in a treatment room waiting to be clerked by a junior doctor. And they had their baby. And I said, right, has anybody got any questions? And one little boy said, yeah, I've got a question. And he just said, are you frightened? And yeah, I did that. Oh, bless him. And the mum and dad went, yeah, do you know what? We are. And nobody's really asked us that. But we're really worried about our baby, but we know we're in a safe place and we know people are going to look after us. So we're confident that we're going to be okay. And that was a real kind of light bulb moment for us because I thought nobody's asked them. Nobody has said, are you frightened? Those really simple questions. So we tried to really listen as much as we possibly could. So now part of our admission pro forma asks parents, what are your feelings? What are your ideas? What are your expectations? You know, some people think they're coming, they're going to be admitted, they're going to have a bed. They're going to be staying overnight, and sometimes we're on a very fast 4-hour observation, turnover, go home. So it's really important to ask people at the start, what are your worries, what are your ideas? And we've now embedded that as a result of this into our admission pro forma. So that was a really kind of poignant moment for us. So what we wanted to do was really listen. So we found it was really important. We've done these kind of top tips for anybody that wants to run a takeover day or bring 10 well children into an acute setting, which some people think is a bit bonkers, but we did it. So it's really important to listen. We wanted the Wonderwall to be a real representation of what they did, and we held a grand opening day where they were able to bring their parents in and see all the hard work actually come to fruition. That's important. They wanted to see the end results, so we had to really carry everything out. And they really felt that our observation area was the most frightening area within child health. They felt like the other areas weren't so bad. So we really listened to them, and we got another school in on the hottest day last summer. 16 children, 4 teachers and a film crew. Oh, and Spotlight Southwest as well. And we made a video that some of you might have seen as you've been walking around the exhibition, which was a sensory tour. I think one of the most important things that became our motto from the day was about stepping into the children's world. That's why I love working with kids. You get to step into their world from the day. And when you're 8 to 10 years old, a lot of that is to do with Harry Potter. So this kind of became our motto, really, from the day, and something that we've tried to remember. The great Albus Dumbledore said, a child's voice, however honest and true, is meaningless to those who've forgotten how to listen. And we really tried to take that on board, actually listen to what they're saying and really kind of put it into action. This was the video that we made. That's the head teacher from St Mary's School in Truro. She's going to be delighted that that picture is up there. And just to finish, I know we're getting close to the end. I just wanted to finish by telling you a little tiny bit about Maddie. Maddie is the little girl there at the end. She has adrenal dysfunction amongst lots of other complex healthcare needs. And she came to Takeover Day and was one of our really, really loud voices on the day. She loved not being poorly and being able to tell people what to do. But she couldn't make it to the grand opening. She was too poorly. So we managed to have a live link up and FaceTime her into the grand opening. That's her on FaceTime and that's all the children. And she is now one of our patient ambassadors and she helped us design this leaflet. So the longevity and involvement of her care will carry on and on and on for us. So thank you.
Brilliant. Thank you.